Always good to be here at the center and back on the campus that I graduated from many years ago. And good to be part of these conversations for these 2 days. I've entitled this session, What Do We Owe the Sick? An Ethical Perspective on Justice. And I want to begin with two stories that will lead us into our thinking today. And I'm going to come back to these two stories continually. They will operate as case studies for us as we think about this very complex arena of justice. Mickey Mantle was a great baseball player. I have to think baseball since Boston just won the World Series and our city is rejoicing. During the 1950s and 1960s, Mantle was known for his unusual combination of speed and power as he led the New York Yankees to 7 World Series championships. 3 times he was named the league's most valuable player, and many considered him, of course, to be one of the greatest all-around baseball players in history. One sports writer described him this way, with a telegenic, boyish grin, an aw shucks Oklahoma drawl, and a big number 7 across his muscular back, he became everyone's idea of what a great baseball player should look and sound like. But of course, there was another side to Mantle's life off the field. He was an alcoholic, and he was known for his undisciplined lifestyle. In 1995, he received a liver transplant as a result of cirrhosis and hepatitis C, obviously, or at least seemingly, coming from his lifestyle. Unbeknown to the transplant physicians, cancer was present in other parts of his body, and several months later, Mickey Mantle died, new liver intact. This event set off a round of debate in the medical community and society at large. Did Mantle receive an organ because he was a great baseball player? Right now, at least as of last evening when I checked, there are 120,594 people on the list with UNOS waiting for organ transplants. Between January and July of 2013, in a 7-month period, 16,670 transplants were performed. Obviously, a great gap. And so, in this triage situation, we are faced with an issue of justice. Who gets the goods when there's not enough to go around? What do we owe the sick in a situation such as transplant needs when not all can receive one? Moreover, what do we do with the fact that Mantle really did live a lifestyle that may have not fit his receiving of the transplant, of the organ? How do we factor in lifestyles, choices? Are they a factor in who gets the goods and what we owe people? Take another case, the Smith family case. The Smiths are a single-parent family of 4. Sally Smith is 36 years of age with children 13, 10, and 8. Recently, the oldest daughter, Susan, was hospitalized for 4 days due to serious complications following an appendectomy. The total bill of the operation, the post-operative procedures and care, came to over $40,000. This is pre-Obamacare. The Smiths had no medical insurance. Mrs. Smith makes $17 an hour as a secretary with a small company, a company that does not provide insurance. With a $35,000 a year salary from her work, the family finances simply have not reached to include medical insurance. They took a gamble and they lost. In this situation, what does society owe the Smith family? Or one might even ask more immediately, what does the hospital and the medical personnel owe the Smith family? And 48 other million Americans without health care insurance. These are the kinds of questions of justice, as we know, that emerge constantly in our society. It might help to begin with some perspectives on justice to get a sense of what we are talking about. Justice has traditionally been understood as responding to the question, what do we owe people, that is individuals, And what do we owe groups of people in the midst of competing societal and moral claims? There are, as we have talked about before, at least two major spheres of justice: the retributive, what is owed a person for the wrongs they've committed; the distributive, what are the goods that we owe a person in the positive sense. Some have added a third part to justice, a third sphere, if you will, called restorative justice. When we deal with health care, the questions such as the Mantle case and the Smith case, I think we're dealing with distributive justice, and that will be the focus of my paper. When we begin to probe this subject, it's important right off the bat, I think, to understand that justice is not the same as love, though they can never be far severed from each other. And I think Nick Wolterstorff's new book on justice and love is helpful. He certainly outlines in that in great depth the way in which justice and love have been understood in the philosophical world and in the theological world. And some theologians, such as Reinhold Niebuhr, have really seen justice and love totally at odds with each other. I'm simply going to state they are not the same, and we must recognize that love, including self-Christian love of the most heroic sort, will not solve the Mickey Mantle syndrome or the Smith family dilemma. In healthcare, we have an obligation to cure, to care, and to care within the bounds of moral constraints. But that is the heart of vocation as a physician, and that is at the heart of our vocation as followers of Christ. But justice goes beyond the curing and the caring to deal with the hard questions faced by both society at large and by health institutions and health professionals. In the midst of inadequate resources, competing needs and claims, what do we owe the sick? And part of what makes justice so difficult is that there are usually competing claims at stake. Justice addresses issues like those in the Mickey Mantle story and the Smith family story. What do we owe the sick when there is not enough to go around? And what do we owe the sick when there are competing moral, logistical, and economic claims? And usually in justice, all of those claims are there: the logistical, the moral, and the economic. Justice involves more than individual decisions, usually. It involves decisions of a whole society, of its institutions. It deals with realities of power, though it can never lose sight of individuals in the midst of the institutions and the power dimensions. How we answer the justice question, what we owe, depends on a number of factors, and it's never simplistic. It is highly complex. As Charlene Gallino put it in an article in Hastings Center Report a number of years ago, both health and healthcare involve a much more complex and diverse set of social relations and contexts, including those at the interpersonal, family, community, state, regional, national, and global levels. A full conceptualization of healthcare as a social good would recognize its multi-layered reality and its many intercontextual connections. But because communities are complex and overlapping entities, any effort to make healthcare more just will be more complicated than most commentators have recognized. And I think that we are seeing that borne out in the current debates. One of the major components in answering the question, what do we owe the sick, depends on our definition of justice. We've thus far in our time together discussed biblical inputs regarding justice. We've looked at the theological. We've come to understand that the words for righteousness and justice are the same in both the Hebrew Bible and in the New Testament. But when we begin to become more concrete and to try to ask, what does justice look like, there are various definitions that have emerged. Historically, in the field of ethics, three main definitions of justice. And usually, it seems to me that most of the debates we have about justice and justice issues hinge on which of the definitions we accept. I want to look at these three definitions and interweave the cases that we talked about, the Mantle-Smith cases, make some comments about each of them, and then at the end want to throw out a proposal for us to think about in light of these definitions. The first definition is what is often called meritorious justice. Here the understanding is that what one is owed is based on their merit, what they merit, their actions, their efforts, certain qualities, perhaps the impact they make. Merit justice accentuates fair procedures and then rewarding people according to what they achieve or how they perform. Merit justice calls forth something from the recipient, and hence it accentuates personal responsibilities. It believes that if fair procedures are in place, a person should be rewarded for what they themselves do in a given sphere of activity. Each person is responsible for their actions in life, and they are then rewarded accordingly. Thus, in a meritorious definition, it's expected that the outcomes of various activities will vary greatly. Inequities will be present in actual rewards because in this model, not all merit the same outcomes. If we apply this to the mantle case, what do we do when not enough to go around? The organs would go to those who in some way merit the cadaver organ. Perhaps the ability to pay, or perhaps they would merit on the basis of lifestyle, healthy lifestyle versus unhealthy, in which the case mantle probably would not have gotten the transplant. Or one may appeal to their role in society. That is, that some roles in society would require a preference over others. They would merit that by virtue of what they contribute to the society. Or, as has actually happened on a couple of occasions, working hard to get the attention of the public and hence procure a donor. And we have seen this on several occasions. It could also include merit and demerit of another sort. Age. For example, in the United Kingdom, elderly end-stage kidney patients have been excluded from dialysis and transplants, age serving as a factor which we might actually term a merit or a demerit. If we apply this to the Smith family scenario, this would likely mean that since the Smiths did not assume personal responsibility to take out at least catastrophic insurance, then they do not merit a coverage of the daughter's expense. They will need to begin the long process of paying it off. In reality, we know, of course, that it will mean that the medical institution will bear the burden. And in our country, they bear the burden to the tune of $41 billion annually. Clearly, there's some biblical and theological support for merit justice. 2 Thessalonians 3:10, anyone unwilling to work should not eat. Or Luke chapter 10, verse 7, the laborer deserves to be paid. Or Matthew 25, the parable of the talents is told by Jesus. In the parable, there's reward for those who invested wisely, and there is demerit for those who wasted the resource. There is then positive aspects to merit justice. When we think about these kinds of texts and the nature of merit justice, I think it's clear that there are some positive dimensions. It accentuates, for example, personal responsibility. And as creatures created in the image of God, we are called to be responsible agents in life. Most people, furthermore, have a clear sense that it's only fair or just that if two people are doing the same job and reflect differences in effort put into the job, time spent on the job, output, and expertise, they would be rewarded according to what they merit. There are, however, negative aspects to merit justice. It seems evident from the Bible and from theological reflection and from natural observation that merit alone will not be adequate. Scripture speaks a great deal about special concern for the poor and the oppressed in the context of the language of justice. Some people, as we know, are in dire straits, not because of effort or lack thereof, but because of circumstances far beyond their control, including sometimes unjust practices and structures which have caused the unjust situation in which they find themselves. Thus, we will certainly want merit to play a role, including perhaps in healthcare. But we have to raise the question, does it truly embody the full measure of justice from a biblical and a Christian worldview perspective? There is then a second definition of justice, and that is egalitarian justice. It has two forms: equal outcomes and equal access. The equal access has been the most prominent form, for as most have realized, equal outcomes would entail unjust procedures to achieve it, and is logistically very difficult to pull off. If one takes the equal outcomes approach to justice, it would mean that all people should be compensated in the same way in given spheres or activities of life. The problem is that assumes that everyone deserves an equal outcome, no matter what they have done, no matter what they have contributed. The often heard critique of a pure equal outcomes approach is that people have to be treated unfairly to treat all alike. And thus, no doubt, the more popular form of equality justice, egalitarian justice, is equal access. In this approach, procedures are put into a place to ensure that all persons have equal opportunity to access the goods and services of society or of an institution. That is, no external or personal factors will limit the right to access. But in the end, not all end up alike. This approach usually emphasizes that society, and particularly the state, must be proactive in ensuring equal access to the goods, rights, and privileges within a society. It won't happen on its own, left up to individual initiatives and actions. In practice, with this definition, it often means similar treatment for similar cases. If we apply this approach to the mantle situation, organ transplants, it would mean that all people would have an equal access, no matter what their gender, race, age, region, or lifestyle. It would assume a kind of lottery method, a blind justice, unaffected by any external characteristics of the person or by particular needs of the patient. If we apply this definition to the Smith scenario, most egalitarians have argued for some type of a system that can ensure that all have at least access to basic health care, whether or not they can pay for it. In terms of technical solutions, there are many suggestions ranging from single-payer approaches that are semi-private to pure state-run system to a public policy mandate that all employers must provide for medical insurance, or those unemployed would be covered by governmental structures such as Medicare and Medicaid. When we reflect biblically and theologically, we can find some support for this definition of justice in general. Being created in the image of God with the implication that all humans have an equal value, dignity, and worth before God has been a hallmark of our thinking thus far in our gathering. That is, our dignity, our value, our worth is not dependent on functionality. There is an egalitarian dimension to it. More specifically, a text like Leviticus 19:15, where the Old Testament law mandated equality in the judicial procedures. You shall not render an unjust judgment. You shall not be partial to the poor or defer to the great. With justice you shall judge your neighbor. Jesus seems to echo an egalitarian emphasis in Matthew the 5th chapter, when he says that the Father in heaven makes his sun to rise on the evil and on the good, and sends rain on the righteous and on the unrighteous. That is, God is not discriminating in granting to humans the basic gifts of life for living. There are then positive dimensions to egalitarian justice. It has certainly been central to modern democracies, and it has certainly been central to human rights around the globe. It has helped to overcome impartial discrimination based on or partial discriminations based on gender, race, ethnicity, or other external characteristics. It's a form of justice that has given hope to countless numbers of people, even if the equality was never fully achieved. Namely, that they should be able to come to a given sphere of life with a level playing field and not be treated partially on the basis of some external characteristic. There are, however, challenges to this approach, to this definition. One challenge is trying to determine what equality or fairness looks like in real life. For example, a few years ago, a rather humorous example emerged in the state legislature of Virginia over a debate that was called potty parity. As the news reported, a legislator decided to go against the flow when he noticed how much more time women spent in restrooms than men. And so he penned a potty parity resolution to help relieve the situation. The legislator contended that the state plumbing code calling for a 50-50 ratio of space for men's and women's restrooms in public restrooms was essentially discriminatory. The Equal Space Code did not take into consideration several contextual factors. The fact, for example, that urinals occupy less space than toilet stalls, and hence men's rooms actually have more facilities than women's. Moreover, elderly women take longer in the toilets, and there are more elderly women than men. And beyond that, younger women often have children in tow with them. The result, contended the legislator, is a need for significantly greater space for women's restrooms in public places than for men's. The story makes the point well. Equality alone will not always take into consideration the contextual factors or specific needs that might call for some accommodation to the equality principle. Egalitarian renditions of justice have also faced another crucial issue. In practice, it is often needed to treat some people unfairly in order to achieve equality, the affirmative action challenge. This critique has been powerfully made by the Spanish literary figure Jorge Luis Borges in his short story, The Lottery in Babylon. Borges depicts a society in which everything is distributed solely on the basis of a lottery. People are assigned roles in life purely by a lottery with no attention to need, effort, or outcomes. One's role in Babylon as a slave, a factory owner, an executioner, a priest, or a merchant is allotted solely by a lottery, a mechanism of pure, blind equality. Roles changed with periodic lotteries, but all were equal. No one can escape the fate of the egalitarian mechanism of the lottery. Borges says, every free citizen automatically took part in the sacred drawings, which were held in the labyrinth of the gods, every 60 nights, and determined each citizen's destiny until the next drawing. The consequences were incalculable. A lucky draw might bring about a man's elevation to the council of the Magi or the imprisonment of his enemy. An unlucky draw, mutilation, dishonor of many kinds, death itself. Borges' outrageous story makes a point. After all, some of the most oppressive regimes in history have been built on models of justice defined as equality. The French Revolution, the various Marxist revolutions around the world. Being focused on achieved equality without a commitment to other virtues, other principles and guiding visions, has sometimes undermined the very thing that it set out to achieve. Thus, egalitarian justice plays an important role in society and in institutions, and likely in our health institutions. But at the same time, there are challenges we cannot overlook from a biblical, Christian worldview perspective, and even a natural perspective. A third definition that has been espoused by some is what we call need justice. In this definition, this third definition, what is owed individuals is based primarily on their concrete needs in a given sphere of life. Since justice deals with institutional and power configurations within society, the need is addressed often to particular groups of people who have specific needs. It accentuates that we must go beyond equality to respond to specific needs, especially among the least that are among us. It often emphasizes a redress for past wrongs. At least historically, that has been very much a part of the need definition of justice. Hence, at times, unequal treatment to redress the past. Need justice argues that merit simply benefits those who have the power and status in society. It furthermore asserts that egalitarian justice doesn't change those benefits that have often accrued to the powerful in society. And hence, justice must look at the concrete situations in life and in society and seek to redress the past wrongs. It must particularly focus on the needs of the least in society or those who have not benefited from past equalities. As one writer puts it, the equal provision of the basic rights requires unequal response to unequal needs. Justice must be partial in order to be impartial. If we apply this to the Mantle syndrome, it would mean making the decision about organ transplants on the basis of the neediest person. Mechanisms would be put in place so that the sickest person would be at the top of the list, regardless of the length of time they had been on the list, and it would certainly do away with any sense of lottery and any sense of merit, according to lifestyle. If we apply this to the Smith case, it would argue that the Smiths are poor through no fault of their own. They are, in a sense, victims of social and economic structures that have kept the powerful and privileged in their place at the expense of those like the Smith family who make so little. And thus this approach would likely push for some kind of a universal health coverage that would ensure that the Smiths have health care. Society itself, and especially those who are wealthy, at the expense of the less wealthy, such as the Smiths, have a responsibility to the least among us. What we owe the sick is the basic essentials of health care. We look to Scripture, we can find theological support for this definition. Deuteronomy 10:17 through 18, God who is not partial and takes no bribes, who executes justice for the orphan and the widow, and who loves the strangers, providing them food and clothing. Or Psalm 140, verse 12, the Lord maintains the cause of the needy and executes justice for the poor. Or the Magnificat of Mary in Luke chapter 1. He has brought down the powerful from their thrones and lifted up the lowly. He has filled the hungry with good things and sent the rich away empty. Clearly, there are some positive aspects to need justice. Stephen Mott and Ron Sider, in an article some years ago, said, hundreds of biblical verses show that God is especially attentive to the poor and the needy. God is not biased, but because of unequal needs, however, equal provision of basic rights requires justice to be partial in order to be impartial. Partiality to the weak is the most striking characteristic of biblical justice. But I think clearly we must say it's not always quite that simple. There are some challenges to the need version of justice. For example, one of the major challenges is discerning what the exact needs of persons and groups really are. Slowly, we've begun to awaken to the realities that along with the needs surrounding poverty and access to basic care in life are also needs for dignity, self-worth, opportunity, the development of skills. These kinds of traits don't emerge best in simply addressing physical or medical needs, but in the context where people bear some responsibility for their life situation. In other words, opportunity for work is always far more meaningful than welfare or handouts. Second, need justice has to deal with the redress mechanism of treating partially to achieve impartiality. When we utilize need justice mechanisms, we will have to be attentive to this reality. We have to be unjust, at least by some definitions, in order to achieve justice by this definition. Furthermore, need justice can easily discount human responsibility and human merit in realms where merit may in some way count. And so as we look at need justice, clearly there is much in favor of it, but taken alone, it may do injustice to other biblical and theological commitments and virtues. So what do we do with all of this? Which definition do we give assent to, especially as we think about healthcare issues? Well, let me make a proposal to us to think about. And the proposal is that we operate with different definitions for different spheres of activity. And I think that we know that we already do this in many areas of life. As we look at the definitions of justice, we have a sense that some settings and activities call for one definition, other settings and activities call for another definition. A number of us here are academics. I think most of us would agree that grading should generally be based on merit. That is, we don't grade on the basis of egalitarian outcomes, although there have been a few who've done that. Let the paper simply go down the stairway and land, and however, or give everybody all A's or everybody all C's. But by and large, we have operated and have agreed that grading should be based on the quality of the paper, the quality of the exam, the quality of the work that the student puts into it. Or pay to workers. Most would agree should include at least some form of merit. Effort, training, qualifications, responsibilities. And we assert this even if we grant that the gap between the high and the low seems way out of whack. Or hiring practices. Most have agreed that it should be based on a general egalitarian model, that though merit plays a role in who gets the particular job, there is an egalitarian framework so that all have an equal access, though not everyone, of course, is going to get the job. Or basic human rights. Basic human rights have been posited largely on an egalitarian model. For handicapped persons with economic needs, most people would agree that there needs to be operative some form of need justice. I think of someone like my older brother who passed away about 10 years ago from cancer. Jim had brain damage at birth and quite handicapped, and obviously in his situation he was unable to work or at least hold a job that was sufficient to be self-sufficient. And I think for most people, when we think about handicapped persons with severe disabilities, need justice would be an operating definition of what justice looks like. These are spheres where at least large numbers of people agree. But obviously, there are huge areas of life where disagreements abound as to which definition should prevail. And so what do we do when we come to health care? Well, let's think for a moment about the Mickey Mantle syndrome. In the Mantle situation, who gets the goods when there's not enough to go around? It would seem that equality and need would be the most fitting definitions. Merit has the potential to greatly distort the process of organ distribution, and there is nothing about receiving an organ that one can truly merit, except for the possibility of living a healthy lifestyle. That is the one form of merit that I think could at least be considered a claim in the mix. But then we have to ask the question, do we really want to make these kinds of decisions on lifestyle? It might be one thing to overrule Mickey Mantle on the grounds of his binge drinking and lack of care for his body, but where do we draw the line? Eating habits, lack of proper sleep, too much caffeine, overweight, and the list can go on. Or what about the merit or demerit of age, if we can refer to those as merits or demerits? Why would a young person merit an organ over an older person? Clearly in African cultures, as John Kilner has described in some of his writings, it would not be the younger who would receive the medical care when there's not enough to go around, but rather the large social web, the wisdom, and the influence of the elderly would be most valued in that triage situation. While we may not wish to use lifestyle merits or demerits as principles of justice, we should note that some of these items may be medical indices rather than moral indices. At times, one might not receive the organ because the medical situation would not warrant it. But that is different than, and that is the benefit that would accrue given their lifestyle would not make them medically viable. But that is different than making the value judgment on their lifestyle, their age, or their physical situation. And if lifestyle is used, it is still a medical viability kind of judgment, it would seem to me. Moreover, we might wish to ask, is a donor organ something one can really merit, considering the tremendous shortage that we have in the world today? It's rather interesting, I think, to just think about that whole situation with organ transplants. Is one really owed an organ transplant, especially given the great disparity between need and reality? And is this kind of justice, is merit justice pertinent when we are dealing with death and life issues? It would appear that the UNOS procedure, that is the United Network of Organ Transplant Organization, that the particular procedure of equality measures along with need, the severity of the situation, would be the most appropriate approach to answering the question, what do we owe the sick in the realm of organ donations? Our current situation and the current model that brings those two together perhaps needs some tweaking, and it must always be instituted with great care. But the blending of equality and need would seem to be the best fit when we deal with the sphere of organ transplants. What about the Smith family case? What do we owe the sick for those who are without access to medical care? To go with any one definition seems to me to be problematic. Merit justice alone will simply leave huge numbers in our society without any health care. It will not fit with the biblical mandates of justice to the poor and the least among us. Egalitarian justice alone will open the door for all, but equal access will not get the Smiths' $40,000 bill at the hospital paid. It will not automatically provide for the 48 million without health care insurance in the United States, let alone the large numbers in the rest of the world. And need justice, which looks so compelling at one level, taken alone could bankrupt a country, and certainly bankrupt healthcare agencies. Can it truly do justice to a stewardship of resources? Does it embody a sense of personal responsibility? Perhaps what is needed then is a policy. Perhaps what is needed is a policy which in some way would give attention to all three definitions of justice and hold them together in a kind of creative tension. As we think about this, it's helpful to recognize that our policies themselves in society or in a given social institution are mechanisms for achieving justice. And there is always a place for varying mechanisms. That is, we need to assess our mechanisms, our policies, our procedures, our strategies in terms of justice, but recall that there is a difference between our ethical norms, the norm of justice, and the mechanisms themselves. That is, we fall prey to the danger of absolutizing the mechanisms or the strategies. In fact, it seems to me that in our current scene, at least in the United States, there's a tendency to relativize our moral principles and to absolutize our strategies and mechanisms. It ought to be, of course, the other way around. But we tend to politicize our strategies, and as a result, good, hard ethical thinking gets lost. In the case of access to health care, we might attempt mechanisms that can in some way hold the three definitions together. And I'm not an expert in this area, so I don't have any concrete suggestions of what this would look like, but I simply throw it out as a paradigm to think about. That is, that we put together a policy that would ensure personal responsibility that goes with merit. And it seems to me that that's the dimension, I think we've already alluded to this numerous times in our time together, that's the dimension that is so often lost in the midst of all of the rights language of our contemporary time. We would certainly also want a procedure that establishes equal access, and one that puts in place mechanisms that can give significant attention to those who have minimal access to the health goods in our society and in our institutions. That is a safety net concept. Pure justice will never be achieved this side of the eschaton. Such a perspective does not let us off the hook, but it relieves us from the tyranny of seeking a pure justice, which in this world only can do injustice to other needs, concerns, and long-term considerations. Historically, pure justice solutions have sometimes turned out to be the most tyrannical, unjust systems in history. And thus, with our finitude and our fallenness of human beings, it may be more appropriate to think about proximate justice, at least in the way we try to achieve it. Moreover, we must recognize that justice is always done in relation to other virtues and commitments. One of the problems, it seems to me, in the midst of many of the debates in our society is that justice has become the trump card, and particularly justice of one of the three definitions. It must always coexist, however, with other values, other commitments, other worldview assumptions. Justice is never the only principle or the only virtue by which we make decisions and by which we frame our policies and our public policy strategies. But it is within such a framework, indeed a complex framework, that we seek to let justice roll down like waters and righteousness like an ever-flowing stream, even in the complex world of health and medicine. Thank you.
Well, thank you very much, Dennis, for a very clear and organized overview of the complexities in this area. And Dennis has another speaking engagement this afternoon.
I can hang on for a couple minutes if anybody just has any questions.
That's what I was going to ask. So we'll take as many questions as you all
are asking.
Thank you, Dr. Hollinger. I just wanted to throw out one thing for clarification, consideration, and that is in your opening questions. What do we owe the sick? And again, I guess this goes, I'm thinking linguistically about the term owe and we. Yeah. Owe implies a debt. And then we depends, and it depends upon what the we, are we talking individually, are we talking the church, are we talking politically, socially? So if you could just maybe talk about that.
Yeah, I think we're generally talking about both individuals and about society. And the reason I'm using the O language is that that's the classic definition of justice that's been used. In other words, people operate their lives in various spheres, carrying out various dimensions, whatever the profession they're in, whatever sphere of life they're operating in. And in these spheres, we ask the question, what is owed them? And I think what really makes this a complicated question today is that it's gotten so bound up with all of the rights language that has far exceeded any sense of due language. And here I think the writings of Walter Storff are really helpful, that the sense of what is due a person simply emanates from the fact that they are created in the image of God. And so we have a responsibility, we owe people certain things simply by the virtue of the fact that they are human, and by virtue of the fact that in the various spheres of life, as they operate, certain things ought to be granted to them. And so the do language, I don't think we want to push it too far, but I simply use that because it is the classic definition. It's been the kind of traditional definition that's been used. I mean, one can try to come up with other definitions. Oftentimes, for example, when I've heard some other definitions of justice, it really moves over into the realm of a reconciliation kind of language, which I think is more of an arena of love. And that's why I think there's a difference here between what is owed people and how we respond to people and engage with them. I mean, if we think about this, for example, in relationship to racism, simply loving individuals did not do away with slavery, the institution of slavery. That is, the justice dimension went beyond the love dimension to ask what is really owed individuals who have been bought and sold in a chattel form of slavery in this way. And so it always goes back to a question of what do we owe an individual and what do we, I mean, that's the question we would ask when we think about a person working for us. But then it always embodies classes or groups of people by virtue of the fact that classes and groups of people have often been treated in various ways. And that's why I think justice comes up relative to those individuals.
Distributive justice deals often with stewardship as well, though. So I'm thinking, is there another term that perhaps could, I don't know, just be used that would reflect that stewardship that we have over the resources rather than the debt?
Yeah, and I think the way I would respond to that, Susan, is simply to say that stewardship is one of those other factors that must be operative as we think about justice. And I think this is where, on the health care, we could bankrupt ourselves as a society over health care, as you all know. And if people simply fixated on a rights approach to justice, and I'm owed this, I'm owed the very best of everything, and I have no responsibility, and so we factor out a particular conception of justice apart from larger stewardship understandings, it can lead to injustice for all, in a sense. And so that was at the heart of my closing points, where I was saying it never is the trump card that operates separate from these other norms and these other commitments that we make in life.
Can I maybe just add another part? I just was wondering, as you're speaking about, we look at huge needs in other parts of the country, or sorry, other parts of the world, or the country, and we say, that's a bummer, you know, I feel bad for them, I hope somebody helps them. And that maybe we need a corrective to that, which owing might bring in to say, actually there is something, some responsibility or debt that I owe to do something to contribute towards correcting some of that need. Would you say that would be?
Yeah, and I think that's very much the case. As we think about what are those correctives, I think we need to think about those kinds of strategies in light of other commitments that we hold as human beings. And let me use one example. Obviously, poverty is a great issue in our world, continues to be a great issue. But I think one of the things that we know about poverty is that the best escape from poverty is jobs. The best way to create jobs is for there to be some kind of incentive and some kind of capital investment into a given situation that enables people, even if it's very small kinds of businesses in a community, but enables them to work and to achieve that sense of dignity that befits their being made in the image of God. And part of the reason I emphasize this is, I think from Genesis 1 and 2, we are made to work. And so when people are unable to work, or when people refuse to work, or we have mechanisms in place in a society which just cause higher and higher unemployment, we really fly in the face of the capability of work, something that is salient to the very core of who we are. And so as we think about justice, I would always want to argue that the best mechanisms for achieving justice must also take into consideration this other dimensions of who we are. We're homo faber. We are intended to be humans who work, who do. There's a creativeness to that. It's part of the having dominion over the world. It's a biblical mandate. We know this through human experience. And we know that the best way out of poverty is work, is jobs. That's why I support economic policies. This is a kind of second level argument, but I support economic policies in a country that really do provide work. So, but that's an application of justice. It's a strategy for achieving justice. And it is also a way of talking about justice in light of the larger frames that we're committed to.
Well, thank you very much. I think we